Again, though.
We have not put any knives to our actual face. I have never got my nose done. I have never had any surgery done to my face.
Hi everybody, I am Ryan Betty. I am the founder of Mysa Medical and Wellness Spa located in Dallas, Texas, and soon coming to Miami and Minneapolis. I want to welcome you to the Mysa Med Spa YouTube channel. Thank you so much for joining us today because we are going into some rather murky waters. If you know anything about me, you know I am severely opinionated and I am super passionate about what it is that I do. I am also exceptionally vain, but I also support people in their vanity to be secretive. So to get started, and before we even start, if you aren't already, please subscribe to our channel and be sure to comment in the comment section. Keep this conversation going. Let me know other videos or whatever else you would like for me to talk about. But let's hop right into it. Today we're going to get into this little, dare I say, cut of a conversation between the infamous Nene leaks and Sierra, I believe, of what is Sierra on? What is she on? I'm asking.
Love and Hip Hop.
Sierra is on Love and Hip Hop Atlanta, and Nene Leakes she is Nene. What are we talking about? If you don't know who Nene is, stop watching this video right now. Go Google Nene Leakes and then come back. Because how do you not know who Nene is? And Nene and Sierra were having this conversation about what work they've had done, right? They're trying to, I guess, address the rumors that people have been having speculations as to how their faces have transformed so drastically over the years. So before we even get into it, let's watch the full clip together.
We were talking a little bit about plastic surgery. Yeah. That a lot of people say that you've had a lot of work done. I know you lost some weight.
60 pounds.
People were saying that, you know, your nose is done, your face is done, your body is done. They say the same things about me. And we want this to be a place where we really tell people how we really feel and what's really tea.
Like,
so
really,
what have you really had done?
I want y'all to come to our living room. We ain't had no motherfucking surgery on our face.
No.
A knife has never, well, to an extent. Because I know my homegirl has had her nose done, respectfully, many years ago. But at the end of the day, we have not put any knives to our actual face. I have never got my nose done. I have never had any surgery done to my face.
Your temples pulled, your eyes, your facelift. I've never had a facelift.
So there's two things I'd like for us to get into in this video. I was sent this video by multiple followers on TikTok. If you're not following us on TikTok, I'm going to put the link to all of our social media pages in the description below. There's a lot more informational, educational videos on our social media pages. But the first thing I want us to get into is ethics, okay? I am a registered nurse. I will always be discussing the ethics of being a medical practitioner, regardless of if it is in the cosmetics industry or bedside manner. Okay, so first is ethics. And the second thing I want to get into is the very huge difference and the great misunderstanding that surrounds cosmetic non-surgical enhancement. And this is not going to, there's no way to say this nicely. As a practitioner within this industry, and this being an industry that is heavily reliant on newer forms of marketing, especially social media marketing, I have seen, and I'm sure you have seen, a lot of doctors, nurses, and various surgeons who have created content and literally built brands around discussing, if not speculating, what celebrities have had done. We've seen doctors speculate Hollywood celebrities all the way down to the Z-list celebrities that are just Instagram famous girls. And here's my thing. I find that to be quite icky because the very first thing that you do as a medical practitioner is swear to do no harm. And when you are spending your time speculating on what a person has done, you are not sure how this is affecting them, especially if this is someone who has repeatedly asked for people to not discuss their looks. We are seeing a lot of that. We are seeing a lot of celebrities come out and say, please stop talking about my looks, stop talking about my changes. I have the right to change my body. I don't have to let you know about what I am doing. And that is well within their rights. We're going to get into how that gets murky later, but for the purpose of practitioners discussing or speculating on the work people have had done as just the general part of their content, I find it to be quite lazy, and that's just me personally. You let me know how you feel in the comments below. But here's what I think. I think it is just gossiping with a degree, okay? You are basically Perez Hilton, registered nursing license. You are Perez Hilton with a medical degree. I'm not saying that they are wrong. I am saying what they are doing is wrong. Because you are a medical practitioner and because you hold a degree, whatever you say is going to appeal more to the public, right? Listening to me with all of my years of experience talking about what I think some celebrity has had done, you're going to believe me more. You're going to trust me more because I have all these years of experience to back up what is purely just speculations. Whereas if some random girl says, here's what I think, and I have no experience at all, and I have no medical training, I just have these thoughts, you won't pay too much attention to that, right? And this is what I think is happening a lot when you see celebrities like Nene and others coming out and saying, hey, I haven't done this, I haven't done that. It is because we have professionals sitting and speculating about what they've had done, and those speculative videos are feeding the minds of the viewers and leading them to believe that yes, in fact, this person must have had this done because I saw such and such nurse practitioner say it. Like I said, as medical practitioners, you have sworn an oath to do no harm. Maybe you haven't literally put your hand on a Bible or Quran or whatever else you do believe in and sworn the oath, but because you are in this practice, people believe you are going to do no harm. That harm is not limited just to your patients or the clients you interact with on a daily basis. That harm is also with people on social media. When you are creating speculative content on what somebody may or may not have had done to their face, you may be doing them some harm, especially if this is someone who has come out and said multiple times, please just leave me alone. The truth about being a celebrity, whether it's a famous influencer or a Hollywood actress or a singer or a rapper, the truth about being a celebrity, especially a woman, is that you are constantly being scrutinized for your looks. You gain 5 pounds and everybody's like, oh my gosh, she's pregnant. You lose 10 pounds, oh my gosh, she's on Ozempic. Like, you're constantly being scrutinized for your looks. And then to sit down and watch someone with a medical degree literally pick you apart, dissect you like a little lab rat on a table, that is doing harm to that person's emotions and their mental health. And so as a medical practitioner, involving yourself in that type of gossip, like I said, I don't think it's right, but let me know what your opinions are in the comment section below. Now, from a purely business perspective, I don't even understand why a licensed practitioner will engage in this type of content, okay? Because when I think about how I want to meet my clients or how I want my clients to meet me virtually before they actually meet me in person, I want them to see me as a source of information, meaning that I want my clients to see me as someone who has had practice and understands the products that are being used, how they are used, and how they can be used to transform them into the look that they want. So speculating about what a celebrity has had done, while that will get you a lot of views, that may not get you any clients. The truth is, if a celebrity's face is trending and you make a video, say, about Glorilla, right, because her face is trending, yeah, you're going to get a lot of views on that video because you're a medical practitioner who is speculating on what Glorilla has had done. However, does that translate into clients? Do those views actually translate into people who are actually interested in your area of expertise? Are those people who actually care about your knowledge, or just people who want to shit on Glorilla? I think it is better, instead of speculating before and afters of celebrity pictures, show your own work, okay? Show us your work. Do a video with your own clients before and after and explain what you did and how you transformed them. This is more informative and more educational to the public, because one of the claims that they make with all of these speculative videos is, oh, I'm just educating the public. You are not educating anyone with pure speculations, right? What am I learning if you don't even know the facts of what you're talking about? You're just guessing based on your knowledge, then what actually am I learning? Versus if you use a video or pictures of your own clients, you can actually speak from a factual place. That is more useful to the public than just pandering in celebrity gossip. Which brings me right back to this viral video with Nene and Sierra. Okay, I was sent this video because a lot of people want my opinion on what I think they have had done. And my opinion is whatever they have had done is none of our business. It literally is not our business. But in the video, and I'm going to attach another clip right here. Let's watch it together.
We have not put any knives to our actual face. I have never got my nose done. I have never had any surgery done to my face.
Pulled, your eyes.
You can see Sierra herself saying that she has not had any surgical work done. Whether or not you want to believe her, that is entirely up to you. The truth is, you can transform your entire face without getting any surgery done. I'm going to put up on the screen one of my videos that has gone fairly viral. This video has over 500,000 views right now on TikTok. In this video, I'm talking about how I've been able to transform my face without doing any surgical procedures. Okay, so let's just watch it together. This is what I looked like before getting any work done to my face. Hi, my name is Ryan. I'm a certified nurse injector and the owner of Mysa Medical and Wellness Spa located in Dallas, Texas. Today, we're going to go over my full facial transformation, and everything I'm going to talk about is non-surgical procedures. I've not had any surgical reconstruction done to my face unless you want to count my veneer. So let's start. As far as fillers, I get fillers in my lips, obviously. I get fillers in my chin, the tip of my nose, and my nasal bridge, known as the liquid rhinoplasty. I do not naturally possess a nasal bridge, and so to construct one, I use filler. As far as PDO threads, I have had a brow lift or the cat eye lift or the fox eye lift done twice with PDO threads. My eyebrows do not naturally sit this high. First time I had it done was 2020 and the second time in 2022, and I've not needed to do it since. It's just kind of stayed in place. Kybella, I've used Kybella on my cheeks to slim down my cheeks and create that like cut crease look. And as far as Botox, I use Botox in my masseter to slim down my jawline and also to help me because I grind my teeth at night. Also use Botox right here because I have a gummy smile. And so my smile doesn't go all the way up and you don't see my gums. Botox in my forehead and my frown lines and the crow's feet around my eyes. I also use Botox right here on my nose to slim down my nose. What is important to note is that I didn't get all of this done in one day. This has been a gradual process, one procedure after the other over the last 7 years. But that was my face then, and this is my face now. Check us out. So like you've seen on that video, I have been able to literally transform my face over a number of years using non-surgical methods. So technically, Sierra could be saying the truth. It is possible that she's had absolutely no plastic surgery, but she has had some cosmetic work done or has even just simply improved on her skincare routine. Because there are multiple studies, and I'm going to attach them in the description box below. There are multiple studies that show that people who even just use sunscreen consistently for a 6-month period who have never used it before see significant improvement in the appearance of their skin tone. And in the video, we also see Nene admitting to getting a nose job. So she has had one surgical procedure that she's admitting to getting. If there are any other changes to her face, those could simply be from a change in her skincare routine, a change in lifestyle. We have seen people who improve their diet and exercise more literally change how their faces look because you're not as inflamed, your body is not carrying as much weight and as much fluid. There are so many different ways to achieve that type of change without going through surgery. Now, like I said, it does get murky. And where does it get murky? I will only take issue with celebrities who are pushing a product that is supposed to do what surgery does or what injectables do and claiming they've never had that surgery done or that injection done. For instance, how many times have we seen girls push their workout routines and their squats and whatever the case may be, and then you find out they got a BBL? Or how many times scrolling on TikTok have you seen that some lady talking about, ooh, this cream is going to do exactly what Botox does. If you get this cream, you're never going to need to inject Botox again. And then you find out that she is, in fact, getting Botox and lying about the performance of this cream. Or someone who says this skincare product, this one serum changed my entire life. And then you find out this person is also getting chemical peels, laser facials, and is using 3 or 4 other skincare products, but they're pushing this one. So they're using the results of their surgery, the results of their injections, the results of their high medical grade skincare treatment to push a product. When a celebrity does something like that, then I would love for medical practitioners to call them out. Up until such a time, there's really no need to have this conversation. But yes, like I said, when it gets murky, when it is obvious that this person is pushing something, they're literally gaining financially from lying to us about what they have had done so as to push a product. Yes, at that point, please go ahead, speculate on, because they do not have the right to be deceptive in their marketing. Here's the 2 things I hope you're taking away from this video, okay? Number 1, seek ethical providers. Like I said at the beginning, our role is to do no harm. And that is not only limited to the people that we are encountering physically or the people who are experiencing our work. That is to everybody that we share these videos to publicly and the people we talk about in these videos. So if a person is willing to sit there and literally dissect a person just for the sake of views, I want you to think about what kind of person does that, right? Like, are you so thirsty for views that you're willing to affect a person's emotions, a person's mental state, especially a celebrity who's already under a lot of scrutiny? And I know people believe, well, they're a celebrity, they're out there so we can talk about them, and especially if it's not your favorite celebrity, right? Like, I personally don't like Kristi Noem. She's not a celebrity. I guess she works at the White House. Where does she work? She's with the government. Who cares? I don't like Kristi Noem. Okay? And so I will always sit and listen to a video of someone absolutely shitting on Kristi Noem. I don't like her. But should I be making videos talking about Kristi Noem when I'm trying to promote my work and promote my skills? Secondly, and I guess more importantly, understand your options. Yes, there's a lot that can be done to the face with non-surgical cosmetic methods like filler and Botox, PDO threads, chemical peels, laser facials, you name it, we have it all. And then there's a lot that can only be done using surgical methods, right? Like when there's excessive hanging skin, when a person has lost 100 pounds, there's no amount of Botox I'm going to use to tighten up the face of a person who's lost 200, 300 pounds. That person definitely needs some skin removal, and that's a surgical procedure. So understand your options. And usually when you have sought out an ethical provider, they are going to give you the best options for you, because at baseline you can trust that they seek to do no harm. At baseline, you can trust this person's ethics. I've had so many clients that I have encouraged, if you're on your weight loss journey, then go lose that weight before we even bother with the filler. Or if you're going to get liposuction, then go do that before we even bother with the skin treatment. Like, that is ethical advice in which you're seeking the best outcome for your client versus just literally wanting numbers. Me personally, okay, and this is me, this is not you. You say what you think in the comment section below, but we're listening to me, so this is me. Me personally, a person who's that thirsty for numbers on their phone is going to be equally as thirsty for numbers in their bank account. And that type of person will always be dangerous to let them on your face.
I have the right to remain silent, but not the ability.
I want to to thank you for making it to the end of this video. Please make sure you are subscribed to our channel. We're going to continue posting videos like this. If you have anything you want us to talk about, feel free to drop it in the comment section. If you have some videos you would like for us to make commentary on, be sure to follow us on any of our social media pages. Again, the links are in the description box. You can just send us a video and be like, hey, what do you guys think about this? And we're going to review it. And if it's worth talking about, we'll make a long form video of it here. Join us next time when we are going to be talking about facial balancing, because you guys will not even believe it, okay? Why did Essence Magazine